Hi, it's Dr. OBT Live, and today we're going to be talking about lip fillers, and I'm going to be talking a bit about my technique, Angel Lips. So basically, Angel Lips is a specialized technique which I have utilized over the years and tried to improve, and I've honed my skills in it. It's basically a natural form of lip beautification. I believe that the lips should not be ever overpronounced and overprojected, which means that they should not be something which, when you look at someone's face, they shouldn't be immediately something which someone notices and says, oh, you got a lip filler. So, of course, whenever you get a lip filler, you have a bit of swelling. So the first couple of days, you do look slightly swollen, but over time, they should actually enhance your overall facial beauty and maximize your other features as well. It's not always about the lips, it's also the area around the lips, but specifically the lips, when I'm injecting with my technique, I make sure that I don't lose the proportion of the lips and the symmetry of the lips. So I make sure that I always undercorrect, I never overcorrect, and I do it in a manner in which it looks natural and the patient's happy and according to their age. So if there's someone much younger, and I don't inject anyone below the age of 18, of course I'll make sure that they're injected in such a way that they look nice and natural, they don't look like they've immediately had a lip filler and their face looks distorted. If they're much older, I kind of tweak my technique to just kind of give more hydration and a bit more shape and body to their lips. So Angel Lips is more about creating or enhancing your own natural beauty, and I use lip fillers which are made out of hyaluronic acid only. I believe any other compound can cause a lot of reactions. Hyaluronic acid is a very skin-friendly compound. Your skin already contains hyaluronic acid, so it's a water-loving compound. So it will pull in some water after some time. It makes it look nice and hydrated, and over time it degrades. So a lot of people think that lip fillers stay forever. Lip fillers do not stay forever. Lip fillers do degrade over time. The only time when fillers can stay much longer are when they're injected in the wrong plane, in the wrong areas where your own body cannot digest it, or if they're outside the border of the lip, for example. And a lot of times I see a lot of people who have gotten fillers overfilled, and because they've gone to multiple practitioners or just tried a new trend of lip filler techniques, and it kind of migrates outside the upper lip or lower lip, and in that case we have to dissolve it using an enzyme called hyaluronidase and then start over again. So if your lip filler is causing a bit of a bump or some nodule or some migration around the mouth or anywhere, it's most likely because of poor technique or too much filler in a smaller space, which causes the filler to kind of migrate and move away from the area you're trying to treat. Thank you very much. Some people digest or metabolize lip fillers much more faster than others. Smokers and people who work out a lot. But on average, I would say that if you're a first timer, it will last between 4 to 6 months. And if you're getting lip fillers for a couple of years now, so it generally lasts a bit more longer than that. Yes, there's a couple of things we should avoid, like aspirin or painkillers, or if you're on your menstrual cycle and that time, and a couple of things like alcohol and stuff, because it can lead to more bleeding and bruising. So I generally like to advise them to come in on a different time, and afterwards you just need icing and a bit of patience. There's a lip filler journey which takes about 3 to 5 days generally. Next day you're a bit swollen, you can do a bit of icing, but then every day the swelling kind of subsides. Some people in 2 days it's gone, some people 5 days. A bit of bruising can happen. Lip is a very, very vascular, rich in blood supply kind of structure, so you have to understand that bruising can happen with any needle work or any kind of procedure. But bruising is not permanent, so it fades away as well. So generally my patients, I say to them to visit me back after 2 weeks minimum, but ideally up to a month later to see how the filler has settled. We use topical anesthesia, we use ice, we use a vibrating device, and the filler itself has lidocaine, which is a pain relieving medication. So we're doing four or five things to reduce the pain. So it's generally not a painful experience at all. But everybody has different pain thresholds. but nobody's ever stopped me in the middle of my procedure, so I feel that not a very painful procedure, sorry. I don't believe you can ever change a lip shape, but you can do little tweaks here and there to kind of improve the weak areas of your lips and accentuate the strong points of your lips, or areas which are a bit more flat, for example, or less defined. You can always make them more defined. You can always improve the lip and the area around your lip to give your mouth a very nice, beautiful appearance. I don't believe in touch-ups. I think that you should just do the filler. It can be, in one filler syringe we have 1 ml. So 1 ml is 1/5 of a teaspoon, so it's a very small amount. And I think that's enough for the lips. And I think any more, we should wait at least 2 or 3 months before we add any more volume, if need be. And does not always need to be the full amount. So I don't believe in follow-ups, in touch-ups, sorry. Follow-up is a good, follow-up is like a review, so you need to come back to show if if you want to improve any other area or you want to discuss any issue. But generally speaking, you're good to go, and you should come back after when it completely dissolves. You don't need to wait. You should ideally wait for it to completely dissolve, but some people just like to have that plump look throughout the year, so you can come anywhere between 4 to 6 months and keep and retain that shape. So it's all about maintenance. So once we build the lip up to to a look which is acceptable to the patient, then it's all about maintaining it. Thank you so much for tuning in today at Dr. OBT Live. Please don't forget to subscribe, and until next time, bye-bye.